celebrated Hahnemann Jayanti yesterday. Last time I had a privilege to visit Germany and give my presentation, a 5-day presentation in Germany. And I had released my book also regarding potency, which I have named it as Abdequaem's Imprinting Paradigm, which also has now 1 year. So in 1 year, we can say that from where I left from Germany till now, I have had so many instances of teaching a lot of European groups and a lot of groups where I have been able to share my cure reports and my way of action of medicines and way of prescribing medicines. And as I always say to everyone, that it is never fixed. Basically, follow Dr. Hahnemann, and then whatever symptoms are in front of you, whatever the miasm is in front of you, take that for prescription, and then for the treatment and the remedy. For example, if a patient of cancer comes to you, it is important to take some syphilitic rubrics first, rather than just taking anxiety and timidity and sadness. Not so important, but take a syphilitic rubric, because the patient is presenting in front of you with a syphilitic disease. So the syphilitic miasm has to be there. So if you prescribe on those grounds, you'll be able to treat and crack a lot of cases in your practice. Walaikum assalam, Dr. Zenith. In the Instagram live, we completed calcarea and natrum mure. Just one remedy which I wanted to share with you, and it was a case of cancer, and the patient, I was treating that case of cancer, and the patient was not improving as much as I wanted him to improve. So he was basically a natrum personality, but I somehow felt that natrum mure was not working. Of course, I'll tell you one thing. In that case, the patient was of throat cancer, and he had a lot of pain in the throat. And for pain, I used to give him Ishnisha, which I normally give for a lot of pain when there is for cancer pain. So I was finding that the patient was not totally natrum mure, and so I had to change the remedy. I was just asking the dream of the patient, and the patient told me, one thing very nice. Yes, sir. For example, you are seeing a movie, and you're seeing a movie, and you go out for you. There is urination, so you go out in the bathroom, go for urination, and come back. So you waste at least 10 to 15 minutes in the theater. But my dream is sometimes very different. My dream is like that. I dream, and when I have to go to bathroom, I wake up, I go to my washroom, I come back, and the dream exactly starts from where I had left. Now, this is a very, very interesting thing, and the dreams are always continuous. When I was searching the mathematical in relation to natrum, I found natrum sulf, where the dreams are continuous. Dreams are coming when he sleeps, and the dream starts. So in this case, I was basically searching for that. So natrum sulf I had not completed in my last Insta live. So I was just telling you something about that. And one more thing, that a natrum sulf patient dreams a lot of about gardens and flowers and a lot of things in relation to that. Do ask the question on my okay, there are a lot of there was my assistant telling us there are a lot of questions. I'll first take the question. Good afternoon, Dr. Vishaka, Dr. Ganesh. My father, aged 84 years, suffering from stomach pain when he is hungry. While he takes food, then pain decreases. Sir, when he goes latrine, he feels very weak. Now see, first of all, 84 years of age. So, in these type of complaints, it is very, very common. Sometimes the patient comes from these stools, and the patient feels very lethargic or weak and all. You can think about 3-4 remedies which I have found very, very useful in my practice. And you have already given some remedies, I think. So when the patient complains of pain, which is better by eating, and there is weakness which is aggravated when the patient comes from stools or urine, write down 3 or 4 remedies, common remedies. Then I tell you some remedies which are very rarely indicated, but I have given those remedies. First, think about phosphorus, second of acid phos, then natrum carb, and then graphitis, commonly indicated remedy. Some rare remedy that you must think about, which I use also very rarely in my practice, and that is, a bowel nosort called dysentery bacillus. Very, very important remedy. I've got good results with that. Second, you must think about lachesis and think about Kalmia latifolia. Sir, patients feel dizzy due to the ill effects of tobacco consumption. What is the best medicine? Yeah, this is a very, very common, problem in patients who are taking a lot of tobacco and all. So normally when we say that homeopaths give, Naxomica. I don't know whether Naxomica works or not, but in this case, one thing you must remember: if the symptom similarity is very indicative of a remedy, please give that remedy. I always say the indicated remedy works as a similimum, as an antidote. So, if the indicated remedy is there, please do give the remedy. If not, then you can think about tabacum. I give tabacum 30, 1 globule of 40 number in half cup of water. Take 1 spoon 2 times in a day for 2 days. That's all. You can try this also, but for me the indicated remedy is the remedy. Okay, we have a lot of cases of opium poisoning, we have cases of patient taking narcotic, we have patients where patient taking a lot of alcohol, and then we have other remedies. So with the indicated remedy, if you want to give a remedy, you can give that remedy. But in case of tobacco, you can give tabacum 30, 40 number globule, half cup water, 1 spoon twice a day for 2 days. Kindly serve medicine, lethargy, feeling drowsiness, think about Nux mosquito, think about gelsemium, think about those remedies, But basically, I want more symptoms. Sir, due to the ill effects of tobacco consumption, we have completed. Interesting, no dreams. Sir, kindly tell some medicine for lethargy. We have done, these conditions. But you can think about Nux mosquito, you can think about, acid phos, you can think about gelsemium, you can think about these type of remedies, okay? So, I need symptom to prescribe. I am not a specific prescriber. For example, for heart problem, mitral stenosis, this remedy, for this protocols. No, every individual is a different patient. Okay, for us, infant dysentery, calm milk. Okay, this is what I don't know who has asked this question. So I was telling something about the. I hope you understood the answer. Pain in the stomach better by eating, and letharginess or drowsiness or a weakness after stool. So we have completed this part of it. So I was just telling something in relation to the Matermedica of natrum sulph. Okay, so a lot of, a natrum sulph patient has a lot of dreams or a lot of things related to gardens and flower or going in a journey. Especially, remember this please, especially if the patient comes and tells you that I have dreams of traveling, especially in boat, in ships, in cruises, then you must think about natrum sulph. Batchet's disease. See, one thing, first of all, you must basically ask me whether I have cured a case of Batchet disease, treated a case. I had about 8 to 9 years back, I had a very interesting case of Batchet disease. She was herself a doctor suffering from Batchet disease, and I treated and cured that doctor. Still the doctor comes to me, she is absolutely healthy. Batchet disease, it's a very rare, multi-system condition characterized by oral or genital ulcers. That doctor had genital ulcers. There are variety of skin lesions. There are eye problems also. It may affect other organs like gut or nervous systems or lungs or arthritis, but it is basically related to ulceration. Especially, I had the case of the genital disease. I still remember I had treated that case with platina, and I treated and cured that case. So very interesting disease you asked me. Fantastic. If you are lucky, you should get some, these type of cases. So you feel proud that we are able to cure these type of diseases. So understand the natrum sulph condition, dreams of traveling in a boat journey or a ship or cruises, then going to beautiful gardens, and dreams of flowers, and dreams of, picnics and riding in a horse and riding in a carriage. These type of dreams, natrum sulph, you will get in most of the cases. Or if, for example, if you have prescribed natrum sulph for asthma, for all the symptoms of asthma like dampness, XYZ, just ask the patient the type of dreams the patient has. These type of dreams, 5-6 dreams, are very common of natrum sulph. I have seen a lot of cases where beautiful dreams, and just compare that dream of natrum sulph to the dream of coffea cruda. A coffea cruda has dreams of paradise, and a natrum sulph very very close, gardens and flowers and picnic and riding with the horse and or riding in a carriage. These type of dreams natrum sulph has. So compare those type of dreams and then you can differentiate between coffea cruda and natrum sulph. Sir, kindly tell some medicines for old age people related to urine infection. Okay. See, again I tell you, basically, first of all, if the patient is suffering from recurrent UTI, that means the patient's immunity has gone down. Take a case and take the history of the case and treat this. Again, if basically you have treated a case of UTI, again the same remedies which we use for UTI you can think about. You can think about, the remedies like petroselenium or cantharis or cannabis or uva ursi or any disorders. But in old age, because immunity goes down, or in any age, if there is recurrency, that means there is predisposition. That means the whole case has to be taken and then you can treat this case. Yeah, that was I was telling Dr. Sir, Batch's disease I have treated and cured that case also. The patient still comes to me, the doctor still comes to me and she is very happy. So thyroid patient generally is getting normal, but TSH levels are not normal. Thyroid, first of all, let me tell you, I have had very good results in my practice. You can ask my fellow doctors who are working with me, they will tell you better that how we are treating thyroid cases. In thyroid cases, you first have to remember what are the common symptoms of thyroid. For example, there is constipation, there is dryness of skin, there is falling of hair, there is dry lusterless hairs, there is weak vision, blurred vision, changeable mood, menses problem, weight gain. So, these type of symptoms are common symptoms of thyroid. And the patient basically feels better in this symptom. That means your remedy has covered few symptoms, but not the basic underlying cause. In thyroid, I have seen if this symptom goes down, the level of TSH has to go down also. But if you find the patient, there is general sense of well-being. The patient says, I am feeling very much light. Remember the wordings of the patient. The patient says, I am feeling very much light and happy. I feel my inches, I've lost in inches also. I am feeling light, and the patient becomes bubbly and enthusiastic. That's a sign that your remedy is working. The patient says, when I get up in the morning, I feel fresh. I feel my face is appearing good. It has become light also. The swelling which used to feel in the morning is better. That's a sign where your thyroid your remedy is working. I had cases where the TSH was 30-40. The patient came directly to me, and now the patient is better with no anti-thyroid medicine. It's fantastic, and we definitely have beautiful results in thyroid cases also. I hope this answer is okay. If you feel the answer is okay, you can tell me by some indications, 100% or thumbs up, or so I know that the answer is okay, and I can go basically in the second part what I want to tell you. So in thyroid, one thing you must remember that, see, the problem is that when you give homeopathy medicine and the patient says he is okay or she is okay, and the report says, okay, the thyroid is 25, and the patient becomes panicky. The patient, in these days we have social media, the patient puts something on ChatGPT and it says, oh, you have to take the tablets, otherwise side effects are there, XYZ, and the patient becomes panicky. And the patient goes to an endocrinologist and says, no, homeopathy, you take homeopathy, but you have to take thyroid medicines also. And then the basic problem starts. Are you getting me? So in today's world, it is very, very important that you should be very sure. Remember my words, you should be very sure that the remedy which you have prescribed is right, and tell the patient that in 1 or 2 months or whatever you feel according to susceptibility, the thyroid, the TSH will go down. If you tell that patient, the patient will wait for you. Otherwise you say, okay, we'll see and we'll do XYZ, all. the patient, you will lose the patient, though symptomatically he is better. You can explain the patient, no, homeopathy will just give, allopathy will only treat the TSH level, rest everything will be as it is. The patient still wants on paper the TSH should be normal. So you have to be very sure with your case taking that your remedy is right, and you can tell the patient that please check the report and it will be better. Okay, I hope it is right. Dr. Bharat, thank you. Yes, sir, patient is happy mentally, but TSH is still okay. TSH is 9, that means it is within the limits. If at all you want to still counter check it, check the immunoglobulin, that is called as anti-TPO, thyroid pre-oxidase enzyme, anti-TPO. So when the anti-TPO is also coming down, then you can be rest assured that the TSH will also come down. Okay. But thyroid, we have a very good scope and a very good treatment in thyroid cases. I really wish that sometimes you come in contact with my practice or my OPD or my doctors who are working with me, so then you can get the right information about the doctor, whether the doctor is only good in the social media or is only telling that I am curing, but in practice what is there. So apart from the lectures which I give in the webinars or seminars, it's okay, but first hand information, if a person has joined a doctor and stayed him for about 1 or 2 months or 3 months, then actually that doctor can tell what is happening in the practice. That's very, very important to give you confidence. For homeopathy, everything is given in the books, but the confidence that we can treat the case, the confidence that the TSH will go down is very, very important as far as I am concerned, because I was like that only when I was attending doctors. Disbalance with extreme weakness in locomotor ataxia medicine. Sorry, I cannot tell you the medicine because this is a very chronic case. Locomotor ataxia, I have few cases. Again, they are much better with treatment, but the whole case taking is very, very important. Okay, so whenever you ask me some questions, please don't be very specific about everything, because I hardly prescribe on specifics, or protocols or the trios. I don't prescribe on those conditions. So getting back to natrum sulph, if there are no questions, please do ask me questions. Otherwise, when I shift on the mater medica, my doctors who are with, they keep on telling me, sir, the questions have come. So there are no questions. The one part of dreams of natrum sulph I have understood. The other part of dream of natrum sulph is also very, very important. A natrum sulph patient dreams of weddings, dreams of wedding procession. The patient has some, dreams of, what do you call, lottery, seeing the number of lotteries. I had a case where the patient used to tell me, sir, I have taken a lottery and that number keeps coming in my dream that I will get the lottery, Okay, so make sure that is also natrum sulph. Okay, that is very, very important. Dreams of the number of lottery the patient sees. Okay, are you with me? Okay, so there are questions. I cannot see questions. I hope if you feel the questions have scrolled up, please write it again. I'll again answer the questions. I think the last question which I can see here is the disbalance between locomotor ataxia, but I cannot see other questions today. So let us go forward. So maybe there's some glitch, you cannot answer the question sometimes because I cannot see it. So let us go forward and see. My assistant doctors are telling that there are some questions still, sir, but let us go to natrum sulph. Okay, so if there are any questions apart from that, please do tell me. So natrum sulph dreams, you have understood, no? Dreams of the number of the lottery which she or he has taken, unpleasant dreams sometimes, and basic dreams of picnics and gardens and flowers and all. Okay, doctor, tell me about lichen planus. What do you want to know? Don't ask me questions which are very, very theoretical. Lichen planus, you can go wherever you get in chat GPT and Google it, you can search. I can start. It's a chronic non-inflammatory, non-contagious inflammatory condition that itching and reddish, flat tops, bumps in the skin, white patches in the genitals or the scalp or the nails, anywhere. It's like an autoimmune reaction. So in this case, like, we have two types of skin which commonly a homeopath have to encounter, and that is what lichen planus and psoriasis. Uh, okay, that I can read. So one question has come that I have lichen planus and my gums are damaged and my side of mouth and blackened. Can you suggest me what to do and explain about lichen planus? Okay. Lichen planus basically is you can say it's an autoimmune disorder. You can say something in the body is something in your body or in the mind, the thought process basically is not working for you, it is working against you. It is a deep seated emotional trauma which you have suffered, and which is you are not able to resolve that, and that is creating a problem in your internal economy. So you have to find out actually what is happening at that time, and then after a detailed case taking you'll be able to treat that. You know why I'm telling you? Because in allopathic medicines the treatment is basically topical corticosteroids, but in homeopathy I have wonderful cases, only a wonderful treatment, but it all depends whatever I have knowledge of treating lichen planus and psoriasis, the same diseases, deep seated internal trauma which you are not able to resolve or which is going on in your life for a long time. So you can go and understand what is the pathology, what is that mental makeup or mental nature which you are going through, then you will be able to treat it better. I hope Dr. Vasthana, you have understood my answer. If not, then you can please tell me so that I can elaborate, and I can give you some remedies also for lichen planus, which I have been treated and have got results. But as I always say, lichen planus case taking is very, very important. Otherwise, in the repertory, you can get a direct rubric also for lichen planus, but I don't know whether it works or not. You know, so this is it. You can think about sulfur. You can think about graphitis. You can think about nitric acid. You can think about calcareous. You can think about these type of complaints. Arsenic. We have calibichrome. I just remember one case where I treated that case with a very, very rare remedy, I can say, that is juglans. Juglans, Juglans, cinerea, Cineria, Cinerea, cinerea. Okay, so I think this is through this question, Dr. Vasanta. If you understand that, you please tell me so that I can go further. Otherwise, I can give you some remedies also. I had some questions on my WhatsApp. Yeah, so I think this is through lichen planus. Can we go further? See, then lichen planus has also one remedy which is very, very common, and it will come in most of the skin disorder, that is sulfur iode or arsenic iode. Okay, so I hope this is answered. Then we can again go to natrum sulph. Natrum sulph, a patient comes to you, especially suffering from diabetes, and the patient has only one symptom. He says, Doctor, बस life में थक गया हूँ, mentally I am so tired, बस कुछ समझ में नहीं आ रहा, just mentally tired हूँ मैं. Just with one symptom, and of course there were a lot of other symptoms in relation to the natrum content. I saw prostration of mind in diabetes. Prostration of mind in diabetes, the only drug is natrum sulph. Also remember one symptom of natrum sulph, and that is a very strong responsibility towards the family. So how will you connect with natrum sulph? A person, he will not say that because family problem is there, because we have separated, because family is not helping me, XYZ. He will not tell you that symptom. But if you find a very strong family bond, and he has taken the responsibility, because of some reason that has been broken, the patient comes with XYZ disease, please, my dear friend, think about first natrum sulph. Whether it is lichen planus, it is psoriasis, it is diabetes, it is cancer, that family bond that has broken, this is an important indication of natrum sulph. Morning, which medicine is best for right kidney stone of 4 mm, Berberis vulgaris, other than this? Yeah, so remedy is like Berberis vulgaris, Thuja, in homeopathy, has been so abused, and that The patient comes with Berberis vulgaris. Okay, sir, I have already taken Berberis vulgaris. Please don't tell me the remedy. Tell me give me something else. Uh, of course, if I want to answer you, I would definitely tell you that side is important, but then there are other things also that you should take care of. But of course, if you have asked me some question, I'll just tell the answer. Think about epismel, think about arsenic, think about pulsatilla, think about calcarea carp, think about bryonia, and think about Prunus spinosa also is a right-sided remedy. Like Berberis, Prunus can be given in mother tincture and Berberis can also be given in mother tincture. So Prunus spinosa, please think about Prunus spinosa. Also a very important right-sided remedy in urinary stones. Very much pain, so much pain the patient bends down because of pain. That's Prunus spinosa. Sir, should we consider symptoms, dreams of violence, abuse, and repetition? First of all, you should consider everything which is very characteristic and which is very syphilitic. I had a case where the patient was only dreaming about war. He said, I have a dream where I am, taking a sword and cutting everybody. I have a dream where I am basically going in the horse and killing everybody with the arrow. These types of syphilitic dreams are very, very important in your practice because it is a syphilitic dream. It is always said that first the miasm sets in, then the disease starts. So if you have a syphilitic miasm going inside the body, automatically you have cancer or syphilitic disorders. So it becomes important if the dream is syphilitic. Like I had a patient where he said that I have a dream that I am cutting everybody, as if he was a timber merchant. So I have a dream that how we cut woods. I am cutting patient's body. Person's body. Very, very syphilitic dreams. He was also very annoyed and unhappy with that dream. So you can think of these type of dreams if it is coming. Violence happening on him. Yes, why not? If there's a dream where he feels that his throat has been cut, his throat has been slit. And how does the patient react is very important. The patient is too much frightened, too much frightened. So we have frightful dreams, frightful dreams. But in this type of cases, if you take as frightful dreams or painful dreams or frightening dreams, then you have lots and lots of remedies. So always, we should have one cover symptom of dream and then one more cover symptoms of patient personality also. That is very, very important. I hope you're understanding the miasmatic approach which I want to tell you. Like for example, dreams frightful. We have lot of remedies. Then you go gradually that what type of fright. The dreams are frightful and followed by fear. Oh my God, what will happen now? So then it automatically is so much frightful that the patient wakes up because of dream. I had a very interesting case of DUB, dysfunctional uterine bleeding, and I was not getting good results. I had used calcarea carp, I had given pulsatilla, I had given sulfur, but no result. So when I was asking the dream, the patient said that my dreams are so frightful, I wake up because of the fright. And then I saw the frightful dream. The patient wakes up. Compared with the flow of the menses, I gave the patient irigeron. It's an acute remedy, but it has a dream frightful. Wakes up the patient with the consistency of the blood, and irigeron cured that case. So this is how you have to interpret the symptoms in miasmatic background. Then you will be able to treat the patients better. I hope you understood that, my dear friend. Are you with me? Anyone? In half an hour, I am a bit fast so that the thought process is completed and then you can apply that in your practice. I hope everybody is enjoying as much as I enjoy, talking to you and sharing my knowledge with you. My fellow doctors has told me now to take Instagram live also. I am taking Mater Medica and questions both live. Though I am tired, but it is important that I impart the knowledge which I am using in my practice. That is very, very important. You can ask my fellow doctors who are working with them. I always tell you, you can ask my practice to my doctors who are working with so that you can get a first-hand information. clinical homeopathy is very, very important. That is important for us. So yeah, thank you everyone for joining me, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Thursday, goodbye.